If you're taking this drug, it could affect your bladder for the rest of your life. I'm Dr. Rena, a urologist and pelvic surgeon, and today I want to share a patient's story, what happened to him, which drug was involved, and how you can protect yourself from the same outcome. This was a 30-year-old man who had been generally healthy until about 2 years ago. That's when he began needing to use the bathroom every hour, urinating constantly, and sometimes he even noticed blood in his urine. He was also waking up 4 times every single night. As you can imagine, that takes a serious toll on your quality of life, because you're barely getting any rest. If you're waking every 2 hours, assuming you try to sleep for 8 hours, your sleep becomes very broken. After some time, his doctors discovered that he had been using ketamine. He had taken it for about 5 years and had only stopped 3 months earlier. So how does ketamine harm the bladder, and what exactly is it? Ketamine is usually used as an anesthetic. It works by blocking a brain chemical called glutamate from attaching to certain receptors known as NMDA receptors. By doing this, it can reduce pain, help with inflammation, and even create some antidepressant effects. However, it has also become popular as a club drug. The reason is that it causes a dissociative feeling. You may feel detached from your surroundings, which can create a sense of euphoria. Many people use it recreationally, and you might hear it called Special K, Vitamin K, or even Kit Kat. What many don't realize is that it can also seriously affect the bladder. A lot of individuals assume it's safe and not addictive, which is why some people experiment with it for pleasure. But what happens when it's used regularly over time? If someone takes ketamine once or twice, they might notice they need to urinate more often, but they usually don't connect it to the drug. With long-term use, however, the bladder can shrink, become painful, and lead to very frequent and urgent urination. It may also cause leakage. In some cases, it can affect the ureters, the tubes that carry urine from the kidneys to the bladder, causing blockages. This makes it harder for urine to flow and can eventually damage the kidneys. In this patient's case, doctors performed a cystoscopy and found severe ulcers in the bladder that were bleeding, along with a very small, contracted bladder. So what can be done? The first and most important step is to stop using ketamine. After quitting, symptoms may improve, but recovery can take time, and for some people, it may never be complete. Doctors can try to manage the condition, treating ulcers to control bleeding, and using medications similar to those for overactive bladder to ease symptoms. Still, improvement can be slow, and in some cases, it may not happen at all. This is a serious condition. In severe situations, patients may even need reconstructive surgery to enlarge the bladder. The bottom line is this: ketamine is not meant for recreational use, and long-term use can lead to severe, lasting bladder damage that may not fully heal. If you found this information helpful, please share this channel with your friends. I truly appreciate your support. And as always, take good care of yourself, because you are worth it.